Hey everybody, just want to make sure that you're staying safe and healthy. We will need you back pretty soon here, hopefully. A couple things, we're sending out this video as an instructional video. In other words, your homework. You get to watch this, memorize it, practice it, until you come on and have to do it naturally, hopefully. So a couple things real quick, just to let you know, all patients will be wearing a surgical mask. A lot of them have been coming in the door with them, so we actually are saving a lot of our masks. The other thing is if anybody has to come with them, someone like an interpreter, somebody with the elderly, anything like that, they will also be wearing a cloth mask. So we're all protected, we're all safe, everything's good. So what we're going to do here is we're going to start out. I have one of the techs, I believe it's Jessica, sitting out in the waiting room. She is playing the patient. I will be the narrator. Trista will be the tech playing your part. And Connie is going to be the staff that is doing the sanitizing. So we're going to get started here and hopefully we'll get it right this time. All right, so go ahead Trista and you can get started.
Jessica. Any fever, cough, shortness of breath?
Nope.
Have you been out of Minnesota recently?
Nope.
Wonderful. Well, we're gonna start with some hand sanitizer.
Okay, so the reason we're doing this, one, Trista asked the question because at scheduling they ask those questions. We want to make sure that at check-in they ask those questions, they get the same answers. When they come through the door, they ask the questions, they get the same answer. If there's any conflicting answers, then we go back out the door, away from the sanitized field, and we figure out what the problem is. Okay, you want to come there?
Come on back. We're gonna go into this room, but I just wanna point out that this sticker means that this room is clean, okay? Okay. So come on in.
Okay, so what this is we have Mr. Clean magnet, and as you saw, the magnet was placed on the outside of the room, showing that the room has been sanitized. Once the tech goes in, they'll move it to the inside, explaining to the patient that we are now going to be using this room and it will no longer be sanitized after we're done. So this is a little bit of a conversational piece. Take some time to get people aware that that's there, and as they continue to come through visit after visit, hopefully they'll understand what that means. But mostly it's for you guys. Okay.
I'm gonna be right back. Just sit tight for a moment, okay?
All right, so the tech is gonna walk over, because the diagnostic equipment was not available, we're gonna come over and we're gonna sign the sheet with your initials and or name along with the room number that you're in. That way, when the room is sanitized, they can come find you at the correct room. So she's gonna head back. All right, so our cleaning person is gonna go in, turn the magnet to the inside. It's already clean, but that's fine. Okay, so what she's gonna do is she's gonna take one wipe, and she starts with the fields that were touched by the tech, provider, and or patient. So we're gonna assume that all of this front side of the equipment, the keyboard, the mouse, the elbow portion of the table have all been touched and contaminated. From there she goes to where the patient would most likely have their hands, and onto the top of the chair. We'll make sure that you do the height bar and or knob that everybody touched to go up and down. One sweep of Lysol. We do not need to spray. We just need to do a clean sweep, and then she's going to move on to the door handles. All right, so we got the door handles, No, other way. You turned it the other way. Okay, so then it goes outside so that we know that that room is clean. All right, then we're gonna go ahead back over to our tech who's been doing the HPI in here.
So the OCT is ready. Oh, okay.
All right, so the knock on the door signifies that they are ready to come out.
Come
The
on.
tech is gonna make sure that the pathways are clear of all other patients. She's gonna go into the room.
This room is clean as well.
All right,
Come on in, have a seat.
so we're going to assume that she did everything she was supposed to do over here. We're not gonna touch anything because it has been cleaned, so we'll just leave it for now. But same process still happens. She's gonna take her patient back, check the hallways, make sure that everything is clear. All right, we're going in and we're gonna finish the exam. Okay. Okay, so, go ahead, Trista, you can start.
What brings you in today?
Floaters,
Which eye are you seeing those in?
the right eye,
And how long have those been there?
about 1 week.
Okay, are you having any flashes in your vision?
No,
Good.
Okay, the reason that we did that is a couple things. Trista has decided that she's going to wash her hands. She's chosen not to use gloves. That will be your choice. We have found out that gloves are very cumbersome. They're hard to work with, so that is completely gonna be your choice. If you have gloves on, you would have sprayed your gloves along with the patient at the entrance. Then you would come in and finish your stuff in here. But because she's washed her hands 100 times today, we did shorten it a little bit. All right, so the other things in here, obviously you're gonna do your normal visit as you normally would. I'm gonna point out a couple things though. We did talk about the Kleenex box. So you make sure that when you give the patient the Kleenex, you handle the box only. You explain to the patient why you are handing them the tissue to take. Just the fact that we only want them to touch it. It is them only contaminating that tissue, okay? The other thing that we wanna make sure of is anytime that you hand them any visual instrument at all, you explain why. Again, these have been already sterilized. We want you to know that we are both safe, and we are gonna be using clean and sterilized instruments, okay? So basically that's kind of it as far as instruments, and I mean everything else that you do is pretty normal. So once the tech is done and your visit part is done, now we have to make sure that the field is ready for the provider. So again, we are gonna start with by the instruments, and you're gonna do the keyboard, you're gonna do the mouse, you're gonna do the field that their hands and or elbows may have touched. Top of the chair, the bar that goes up and down. Just gonna move to the handles, front and back. All right, now, if a patient did not bring anyone, then you don't really have to worry about the chairs unless they might have thrown a coat or a sweater or a purse or something like that. Then you need to wipe the handles and do a swipe of the spray on both chairs. Otherwise, they're fine. There's nothing really that you would have to worry about there. You can use the spray on the handles, but please do not spray everything. It's a sweep, it mists, it will spray, don't worry about it. It kind of chokes you up after a while when you get all that Lysol on here. Okay, so that's kind of it. Now it's ready for the provider. So we're gonna head back, or Chris is gonna head back out here. Okay, we're gonna take the patient. All right, so out here, we do have the lines on the floor, 6 feet apart. We wanna make sure that we have no more than 3 people. So right now we have 3 markings. Depending on how heavy the traffic gets, we may cut this down to 2. But there'll be for sure 2 marks, 6 feet apart. So if these are full, then you need to keep your patient in the room until this pathway is clear, or at least till we have more openings. So just kind of be aware of that there is no crossing in the hall of patients whatsoever at any time. So you have to be really aware of where your patient is and what's happening with everyone else. Okay, so that's the end of patients checking out. Now we're gonna go back and clean the room. So she would go back into the exam room. Connie's gonna head back in. All right. So you might want to go over a little bit. Yeah, okay. So this is going to be done the same by everyone. So this is what I want you to make sure that you really, really watch. Again, the patient and provider field. That is done thoroughly, all the way through, front, back, all the knobs, anything that possibly could have been touched. You don't know what has been touched, so you assume that everything has been touched.
Don't drop them.
And don't pick up the one that she drops on the floor. So scary to be videotaped. So this is an actual cleaning because the patient that was in here before, we didn't do the full cleaning. So these makeshift breath shields, they are kind of lightweight. So we are getting heavier ones either made or we're gonna try to get some more. But for now, they work, both sides, clean them. You know, we'll do something better as more product comes in. But all right, so she's gonna finish up that and then she can go on to the 4-opter. We're gonna assume no matter what that the 4-opter was used. So you're gonna go front and back on the 4-opter, obviously not the lens. All right, from there you're gonna go to the hands, the portion of the chair that the armrest or hands most likely touched, and then start from the head position and work down on the chair, all the way to the feet. All right. Okay, then we're gonna toss that one. The next sheet that comes out is going to pick up the instruments first. All right, so instruments will, instruments get cleaned first. It's a lot to remember. All right, then the field can be cleaned. And you can lay the instruments back onto the sanitized field. Okay, she's doing the remote. We're doing, most likely they use drops, so we're gonna pick up the drops and kind of use those up a little bit. Alright, from there, the keyboard, the mouse, the fields. There happened to have been a clipboard in here. Obviously it came in here for a reason with paperwork, so we're going to do that. Alright, and she's going to move on to the chair, top of the chair. Okay, the lever for the up and down. Going over to the handle, door handle, fronts and back. Okay, and then we're gonna assume that the chairs were used this time, so she's gonna do the handles on the chairs. Did you bring Lysol?
I did not.
Okay, and then we're gonna assume that the Lysol is going to be used, so just one quick sweep, and just do it nice and high above it. It'll spray all over. So that is pretty much it. We are done. Please be working on that while you're at home, while you have a chance to kind of get it in your head, because when you get here, it is going to be so foreign. Wearing masks is very difficult. It's hard to breathe. You'll learn to process all of that. Wearing gloves is very difficult all day long, so anybody that hasn't worked in the field that had to have all this PPE on, it's going to be tough for you. So stay safe, stay healthy, see you soon.